Aging is a natural part of life, and as seniors grow older, their bodies and minds go through changes. But sometimes, those changes signal more than just aging. They could be signs that a loved one is in their final year of life. Recognizing these subtle warnings can help families provide the best care, ensure comfort, and create meaningful moments in the time that remains. For those over 50 who are caring for elderly parents, grandparents, or other aging loved ones, it's important to know what to look for. Many of these warning signs are easy to dismiss as normal aging, but when they start happening more frequently or in combination, they could be indications that time is running short. In today's video, we'll explore 5 key signs that an elderly person may be in their final year. The changes in their body, behavior, and overall well-being that should not be ignored. Sign number 1. A noticeable decline in daily functioning. A noticeable decline in daily functioning is often one of the first and most concerning indicators that an elderly person may be in their final year of life. These everyday tasks, which once seemed effortless, become increasingly difficult or even impossible as the body weakens. The changes may start subtly, a forgotten meal here, an unsteady step there, but over time they become more pronounced, signaling that the body is shifting its priorities towards survival rather than routine activities. Mobility issues are among the most obvious red flags. A senior who was once able to walk around the house with ease may now struggle to get up from a chair, rely more on furniture for support, or show signs of unsteadiness and frequent falls. Weak muscles, joint pain, and reduced coordination make movement more difficult, increasing the risk of injuries. A decline in mobility is often a sign that the body isn't recovering as well as it used to, and may be using its energy to maintain basic functions rather than physical activity. Changes in personal hygiene and grooming habits can also indicate a decline. If a once well-groomed senior suddenly stops bathing regularly, neglects oral care, or wears the same clothes for days, it may not just be forgetfulness. It could be due to exhaustion, weakness, or an inability to manage basic self-care. These tasks require balance, coordination, and effort, and as energy levels drop, they often become too overwhelming. Some seniors may avoid bathing altogether out of fear of falling, while others may simply no longer have the physical strength to stand in the shower or reach certain areas while grooming. Eating habits also tend to change significantly. Seniors who once prepared their own meals may lose interest in cooking, forget to eat, or start skipping meals entirely. This can lead to unintended weight loss and malnutrition, which only worsens their physical decline. Cooking requires standing for extended periods, handling utensils, and remembering recipes, all of which may become increasingly difficult. In some cases, reduced appetite may also be the body's natural response to shutting down. When the digestive system slows, the body no longer processes food as efficiently, making meals feel like more of a burden than a necessity. Managing medications can also become a challenge. Seniors in their final year may forget to take their medications, take the wrong dosage, or struggle to open pill bottles. This is especially dangerous for those on essential medications for conditions like high blood pressure, diabetes, or heart disease. A sudden inability to manage medications properly can be a sign that cognitive function is declining, further indicating that the body is entering its final stage. Attending doctor appointments or following medical advice may also become less of a priority for an elderly person who is experiencing significant decline. They may miss appointments, refuse treatments, or become less engaged in their health care. This can be due to fatigue, confusion, or even an unconscious acceptance that their time is limited. For family members, it's important to observe these changes closely. If an elderly loved one was once independent, but now relies heavily on others for even the most basic tasks, it may be time to consider additional care options. Home care support can help seniors with bathing, meal preparation, and medication management, while hospice services can provide comfort-focused care if a doctor determines that they may be in the final months of life. Declining daily functioning is not just a sign of aging, it's often a sign that the body is slowly shutting down. While these changes can be difficult to witness, acknowledging them and making adjustments to provide care and comfort can make all the difference in ensuring that a loved one's final months are as peaceful and dignified as possible. Sign number 2: drastic weight loss and decreased appetite. Weight loss is often associated with normal aging. But when an elderly person experiences significant and unexplained weight loss, it may indicate that their body is entering its final stages. This is not simply due to a slowed metabolism or a reduced level of activity. It is often a sign that the body is conserving its energy for essential functions rather than digestion. In the final year of life, many seniors lose interest in food entirely. Meals that once brought them joy may no longer appeal to them. Portion sizes shrink, snacks are left untouched, and favorite dishes go uneaten. These changes can be gradual or sudden, but over time the effects become more noticeable. Looser clothing, a thinner frame, and an overall frail appearance. A decreased appetite in elderly individuals is often accompanied by a shift in the body's ability to process nutrients efficiently. The digestive system slows down, leading to less absorption of vitamins and minerals, which in turn contributes to further weakness and weight loss. Some of the most common signs of appetite loss in seniors include eating much smaller portions or skipping meals altogether, no longer craving favorite foods or showing indifference to meals, forgetting to drink water, leading to dehydration, complaining about difficulty swallowing, dry mouth, or changes in taste. For some seniors, the texture of food may suddenly feel different, or flavors may seem bland due to changes in taste buds. Others may struggle with chewing or swallowing, making the act of eating frustrating or even uncomfortable. Another common issue is fatigue during meals. Eating requires effort. Chewing, swallowing, and even sitting upright for extended periods can be tiring for someone in the later stages of life. As the body weakens, it prioritizes breathing, circulation, and organ function over digestion, leading to a natural decline in hunger. One of the most serious risks of reduced food intake is malnutrition and dehydration. When the body lacks essential nutrients, it becomes weaker, making it more susceptible to infections, cognitive decline, and increased frailty. Dehydration in particular can cause dizziness, confusion, and kidney strain, further accelerating the decline. What can caregivers and family members do? Watching a loved one lose weight and refuse food can be heartbreaking, but forcing meals is not the solution. Instead, focus on comfort and nourishment in a way that aligns with their needs. Offer small, nutrient-dense meals that are easier to consume. Foods like soups, smoothies, yogurt, and soft-cooked vegetables are gentle on the stomach while providing essential vitamins. Encourage hydration by offering water, herbal teas, or electrolyte drinks to prevent dehydration. If swallowing becomes difficult, ice chips or flavored gelatin can help. Serve meals in a relaxed setting to reduce stress around eating. Play soft music, keep portions small, and avoid overwhelming them with large plates of food. Pay attention to food texture and temperature. Warm, soft foods may be easier to swallow, while overly dry or tough foods can be a struggle. Consult a doctor or dietitian about nutritional supplements if necessary. Some seniors may benefit from high-calorie shakes or easy-to-digest protein drinks. Understanding the bigger picture. It's important to recognize that appetite loss in the final stages of life is often part of the natural dying process. The body knows what it needs, and sometimes that means reducing food intake. Rather than focusing on weight gain, the goal should be comfort, hydration, and emotional well-being. If an elderly loved one is losing weight rapidly, refusing food, or appearing weaker, it may be time to discuss hospice or palliative care options with a healthcare provider. These services focus on quality of life rather than prolonging it, ensuring that seniors receive dignified, compassionate care in their final months. Drastic weight loss and reduced appetite can be difficult to witness, but it is often a sign that the body is naturally preparing for the next stage. By offering gentle nourishment, ensuring hydration, and creating a peaceful eating environment, family members can help their loved ones feel as comfortable and cared for as possible in their final journey. Sign number 3: increased fatigue and sleeping more. Often, as people age, it's normal to slow down, rest more often, and feel less energetic than in their younger years. However, when fatigue becomes extreme and sleep takes up most of the day, it may indicate that the body is entering its final stages. For elderly individuals in their last year of life, the body gradually begins to conserve energy, prioritizing essential functions like breathing and circulation over movement, conversation, or daily activities. This means that even the simplest tasks, getting out of bed, eating a meal, or staying awake for an entire conversation, can feel exhausting. Common signs of increased fatigue in seniors. Nearing the end of life. Sleeping for longer periods during the day, sometimes up to 18 hours or more. Feeling too weak to get out of bed, even for short walks or meals. Struggling to stay awake during conversations, often drifting off mid-sentence. Losing interest in watching TV, reading, or engaging in hobbies they once loved. Experiencing slower responses and a general lack of alertness. This isn't simply age-related tiredness or depression. It's the body's way of preparing for its final transition. Energy is being redirected toward vital organ function, and as a result, non-essential activities like physical movement, digestion, and even social interaction become too much to handle. Why does this happen? The body is slowing down, and as the heart and lungs begin working harder to maintain function, there's simply less energy available for other activities. A senior who used to be able to walk to the kitchen or chat for hours may now struggle to keep their eyes open after just a few minutes of conversation. The brain also plays a role in this process. As circulation slows, oxygen supply to the brain decreases, leading to mental fog, disorientation, and prolonged drowsiness. This is why many seniors in their final year experience longer sleep cycles and reduced periods of wakefulness. In some cases, medications, especially pain relievers, sedatives, or treatments for chronic conditions, can also contribute to increased drowsiness. It's important for caregivers to review medications with a doctor to ensure that excessive fatigue isn't a side effect that could be managed differently. How families can support a loved one experiencing extreme fatigue. One of the most important things families can do is respect the body's natural process. It can be difficult to watch a once active loved one sleep for most of the day, but forcing them to stay awake, move around, or engage in conversation when they are too exhausted will only make them uncomfortable. Instead, focus on creating a peaceful and comfortable environment where they can rest without disturbance. Ensure they have a comfortable sleeping space with soft pillows, warm blankets, and an adjustable bed if needed. Allow them to wake up naturally rather than waking them at scheduled times for meals or activities. Offer light, nourishing meals when they are awake rather than forcing a structured eating schedule. Speak gently and be patient. Seniors who sleep frequently may wake up confused or disoriented and need time to adjust. Spend quality time with them when they are awake. Even if they are only alert for short periods, those moments of connection can be meaningful. Understanding the bigger picture. Excessive sleeping and extreme fatigue can be alarming, but it is a natural part of the body preparing for the final stages of life. It's not laziness, sadness, or a loss of interest. It's simply a shift in energy and function as the body begins to shut down. For families, this is often a sign that it's time to adjust expectations, slow down, and focus on comfort rather than routine. If an elderly loved one is sleeping significantly more and struggling with even basic tasks, it may also be time to discuss palliative or hospice care options to ensure they receive the right level of support. The final months of life are about preserving dignity, ensuring comfort, and making the most of the time that remains. By understanding and accepting these changes, family members can provide love, reassurance, and peace to their loved one in their final journey. Sign number 4, increased confusion, memory loss, and social withdrawal. Cognitive decline is a common part of aging, but when confusion, memory loss, or social withdrawal suddenly worsens, it may indicate that the body is entering its final phase. These changes can happen gradually or seemingly overnight, leaving family members feeling concerned and unsure of how to respond. When an elderly person is nearing the end of life, the brain may receive less oxygen and nutrients, making it more difficult to process thoughts, retain memories, or even recognize familiar faces. The result can be disorientation, agitation, and even hallucinations. Common signs of increased cognitive decline in a senior's final year. Forgetting familiar faces, places, or important memories, even close family members may become unrecognizable. Struggling with time awareness, losing track of the day, date, season, or even whether it's morning or night. Experiencing vivid dreams or hallucinations, some seniors may talk to people who have passed away or describe seeing things that aren't there. Becoming easily agitated, anxious, or withdrawn, losing interest in conversations, avoiding social interactions, or becoming irritated without explanation. These cognitive changes aren't just symptoms of dementia or Alzheimer's. They can also be part of the body's natural shutting down process. The brain requires a steady supply of oxygen and nutrients to function properly, and as circulation slows, mental clarity begins to fade. Some seniors may start mixing up reality and dreams, speaking about past events as if they are happening now, or recalling childhood memories with intense detail, while forgetting what happened yesterday. Others may simply withdraw from interactions altogether, becoming quieter and less engaged with the world around them. How to support a senior experiencing cognitive changes. Stay patient and calm. If your loved one becomes confused, avoid correcting them harshly or making them feel embarrassed. Instead, gently guide the conversation and provide reassurance. Maintain a peaceful environment. Loud noises, bright lights, and overstimulating situations can increase agitation. A quiet, familiar space can help reduce confusion. Encourage gentle interactions. Holding their hand, playing soft music, or reading to them can provide comfort without overwhelming them. Avoid arguing or forcing memory recall. If they don't recognize you, don't take it personally. Instead, introduce yourself each time and meet them where they are mentally. Memory loss and withdrawal can be one of the hardest changes for families to witness, but it's important to remember that this is not a conscious choice. It's simply the body's way of preparing for the final stage of life. Offering reassurance, patience, and love is the best way to support them through this transition. Sign number 5. Changes in breathing, skin color, and body temperature. As the body nears the end of life, physical changes become more apparent. These transformations may be subtle at first, but in the final weeks or days, they become clear indicators that the body is slowing down and redirecting its remaining energy to essential functions. Common physical signs that indicate the body is preparing for the end. Breathing becomes shallow, irregular, or labored. This is often referred to as Cheney-Stokes breathing, where breaths are rapid and deep, followed by long pauses. Long pauses between breaths. These gaps can last for several seconds and may appear alarming to loved ones. Skin becomes cool to the touch, pale or bluish. As circulation slows, the body prioritizes blood flow to vital organs, reducing warmth in the hands, feet, and limbs. Swelling in the hands, feet, or legs. This is caused by fluid buildup due to reduced circulation and kidney function. A noticeable drop in body temperature. This may cause seniors to feel cold even in a warm room, requiring extra blankets or warmer clothing. These physical changes may seem distressing to witness, but they are part of the body's natural shutting down process. The body is not in distress or pain. It is simply transitioning. How families can provide comfort-focused care. Keep the room calm and peaceful. Soft lighting, a quiet atmosphere, and familiar surroundings can create a sense of security. Use warm, soft blankets to keep your loved one comfortable, but avoid overheating them. Hold their hand or sit beside them. Even if they cannot respond, physical touch provides reassurance and a sense of presence. Monitor their breathing without panic. Irregular breathing patterns may seem concerning, but they are usually painless. If discomfort appears, a doctor or hospice nurse can adjust medications for comfort. Understanding the final transition. In the last days or hours, these changes may progress further. Breathing may slow even more, skin may appear more mottled, and responsiveness may decrease. It's important to remember that this is not suffering. This is the body following its natural course. During this time, what matters most is providing love, comfort, and presence. Many seniors can still hear even when they cannot respond, so speaking softly, playing music they love, or simply being near them can bring peace. While it's never easy to witness these final stages, knowing what to expect can help families feel more prepared, more present, and more focused on making their loved one's transition as peaceful as possible. Recognizing the signs and providing comfort. Watching a loved one go through the final stages of life is one of the hardest experiences a person can face. The changes, physical, emotional, and cognitive, can feel overwhelming, leaving family members uncertain about what to do or how to help. But understanding these signs can provide clarity, preparation, and an opportunity to ensure your elderly loved one's final months, weeks, or days are as peaceful and comfortable as possible. Each of the signs we've discussed, declining daily function, drastic weight loss, extreme fatigue, increased confusion, and physical changes, are the body's natural way of preparing for the end of life. These shifts are not signs of suffering, but rather indications that the body is redirecting its energy toward its most essential functions. For family members and caregivers, the most important thing you can do during this time is to focus on comfort, presence, and love. Create a peaceful environment. Soft lighting, gentle music, and a warm, comfortable space can bring reassurance. Prioritize quality time, even if conversations are shorter or interactions are quieter. Simply being present is meaningful. Respect their needs and limits. Forcing food, activity, or conversation is unnecessary. Instead, follow their lead and meet them where they are. Provide gentle touch and reassurance. A soft hand to hold, a calming voice, or simply sitting beside them can bring immense comfort. Accept help when needed. Hospice and palliative care professionals are trained to support families through this process, offering medical guidance and emotional support. While this journey is never easy, knowing what to expect allows you to focus on what truly matters, ensuring your loved one feels safe, cared for, and surrounded by love in their final days. If you're facing this difficult time, remember that you are not alone. Reach out for support from family, friends, or hospice professionals who can guide you through this process with compassion and understanding. The final stage of life is not just about saying goodbye. It's about honoring the time that remains, cherishing the moments you still have, and creating a peaceful, loving farewell for the person who has meant so much to you.